So today's lecture is on the medial compartment of the thigh, which is also called adductor compartment, depending on the action of the muscles present in this compartment. Let's take a look at the location of the muscles present in the medial compartment of the thigh. The muscles included in the posterior compartment of the thigh are gracilis, which is the superficial most muscle and most medially located muscle in the adductor compartment of thigh. Next to it lies the adductor group, which include the muscles adductor longus, adductor brevis, and adductor magnus. And last but not the least, the deepest muscle among the medial compartment thigh muscles is the obturator externus. Gracilis is the medial most muscle and the superficial most muscle in the adductor compartment. Then most anteriorly placed muscle in the adductor compartment is adductor longus, which lies just below the pectineus muscle. If during dissection you will cut down pectineus and adductor longus and raise their flaps, you will come to see the deeper muscle which lies under the cover of adductor longus and pectineus, which is called adductor brevis. So this is adductor brevis. Further deepest lies the most posterior muscle, which is quite powerful and large in mass. It is called adductor magnus. Obturator externus is the deepest of all, and it lies in the supromedial aspect of the adductor compartment of thigh. So in this diagram, again, look at the location of these muscles. Here, the superficial most muscle in the group, which is gracilis, a strap-like, ribbon-like muscle running vertically downward. Then we have anteriorly placed adductor longus. Deeper to it is the adductor brevis. And further above to adductor longus, anteriorly placed and medially placed is the pectineus. So let's take a look at the attachment of these muscles one by one, their nerve supply and action. Here we have gracilis muscle. Gracilis muscle is a thin strap-like muscle which is vertically placed in the adductor compartment of the thigh. It is proximally attached to the anterior surface of the body of the pubis and runs vertically down to get attached at the medial end or the medial aspect of the upper part of the tibia, along with two other muscles, one from the anterior compartment, sartorius, and the other one from the posterior compartment of thigh, semitendinosus. Together, these three muscles, they fuse distally to get attached over the medial aspect of the upper end of the tibia. And they give, their distal attachment gives an appearance of goose foot, like this, hence named as pes and sarinus. Another significant point related with these three muscles is that these three muscles, they cross two joints. One proximally hip joint and the other one is the knee joint. Nerve supply to gracilis is by obturator nerve, which is a branch arising from the anterior division of the lumbar plexus. And its action is adduction of the thigh at hip joint, and since it is getting attached over the tibia, so it also helps in flexion of the leg at knee joint. Okay. Next muscle is we have adductor longus muscle. Adductor longus muscle here in this diagram, its two cut ends are shown. Here we can see that adductor longus proximally arises via a tendinous attachment from the body of the pubis, anterior surface, and inferior ramus of the pubis, runs down anteriorly and downwards to get attached over the middle part of the linea aspera, which is located on the posterior aspect of the femur. Adductor longus muscle is also supplied by obturator nerve, and its action is adduction of the thigh at hip joint. After cutting adductor longus, we are able to see adductor brevis. Adductor brevis is placed deep to adductor longus and pectineus muscle. Another significant point related or associated with adductor brevis is that it is present between the two divisions of the obturator nerve. Here in this diagram, we can see obturator nerve arising from the anterior division of the lumbar plexus. It descends down, and soon after it emerges from the obturator canal, it divides into two divisions, a posterior division and an anterior division. And both of these divisions pass over the anterior and posterior aspect of the adductor brevis. So this point is useful during dissection to identify adductor brevis muscle. Nerve supply of the adductor brevis is obviously by the obturator nerve, and as you can see in this diagram, it is arising from the isquiopubic rami and getting attached over the upper part of the linea aspera just beneath the attachment of the pectineus muscle. This muscle shown in green is adductor magnus. It is deeply placed posterior muscle in the adductor compartment of thigh, as well as it's quite powerful and huge muscle. It is large muscle. It arises from the two attachments. It has two parts based on its proximal attachment, especially. The part that arises from the pubic bone is called adductor part, and the part that arises from the ischial tuberosity is labeled as hamstring part. So it has two parts, an adductor part and a hamstring part. Both of these parts, they get attached on two different distal attachments. Adductor portion of the adductor magnus muscle gets attached over the linea aspera, as well as upper part of the medial supracondylar ridge via an aponeurosis. So it has an aponeurotic distal attachment. Secondly, we have the hamstring attachment, which gets attached over the adductor tubercle located on the superiorly over the medial condyle of the femur, and this attachment is tendinous in nature. So adductor part has aponeurotic distal attachment and hamstring part has the tendinous attachment. In between these two distal attachments of the adductor magnus, you can see that here is a gap between these two distal attachments of these two parts, adductor and hamstring part. This gap is called adductor hiatus. It's an opening through which neurovasculature exits or enters the posterior compartment and or runs between the anterior and posterior compartments, especially over the popliteal fossa, back of the knee. Nerve supply, since it has two parts, the part arising from the medial compartment and the part present in the posterior compartment of the thigh. So naturally it receives dual nerve supply, or two nerves supplying to it, one from the medial compartment, that is obturator nerve, and the other one from the sciatic nerve, especially the tibial portion. So it's a hybrid muscle because it receives double nerve supply. Its action is obviously primarily adduction of the thigh at hip joint. In the last, we have obturator externus muscle. Obturator externus, as we mentioned earlier, is located in the supromedial aspect of the thigh. It arises from the outer surface of the obturator foramen and obturator membrane, adjacent part. It passes below the hip joint, to which it provides stability as well, and gets attached over the medial aspect of the greater trochanter of the femur. It also receives its nerve supply from the obturator nerve, and it forms part of the lateral rotators of the thigh at hip joint. As well as it provides stability to the hip joint, since it is passing just under the hip joint and to which it is closely associated with. So this was all about the medial compartment of the thigh muscles, their attachments, nerve supply, and action.